Hi, I'm Dr. Mehboob, MD Ophthalmology from Aims, New Delhi, and we are here back with the continuation series of Take a Sip with OPHTHA Quick, where you will learn important topics in ophthalmology relevant to the next PG or the Neet PG examinations, and in the very short and 3 to 4 minutes of the time, and you will be able to solve many of the MCQs from that topic only. So do watch all the sips and you will be having a great and fun learning. Okay, so here we are with sip 8, that is metabolic keratopathy part 1. Though it's a rare topic, most of the examination they will not ask this metabolic keratopathy in such a detail. So the only relevant points and the relevant topic that I have created especially for the Neet PG examination, next PG examination, and also FMG students can watch this for the learning. Okay, so here we start with this. So this is what one of this is the cystinosis, other one is the mucopolysaccharidosis. Cystinosis is actually what you need to know because of the CTNS gene defect. Okay, it's an autosomal recessive disease. AR means autosomal recessive disease. Since, and this you can see the bright deposition here. These are the crystals, these are the cystine crystals. Okay, these are the cystine crystals which get deposited here on the cornea. Okay, and then this will give a crystalline appearance like this. One second point is this cystine crystals also deposited in the kidney, and that there can cause the nephrotic diseases. So this cystinosis can have the two types of the diseases, non-nephrotic and nephrotic, but ocular is the non-nephrotic manifestation. And how to treat this, you just need to know cysteamine. Obviously for cystinosis, give the treatment of cysteamine. This is about. Now coming to this mucopolysaccharidosis. This mucopolysaccharidosis is very important. See, mucopolysaccharidosis, can you see this total corneal haze type things? And if you see there is if you stain this, you will have the punctate ossification sometimes you will find. So it is a very important to understand. It's an autosomal punctate opacification with the diffuse corneal haze. This is mucopolysaccharides. But what is most important for the MCQ point of view is that in all types of the mucopolysaccharidosis, you will find this type of feature. But there are the two exceptions which is important for the MCQ, that is Hunter and Sanfilippo. So you have to remember this point, and this is very important as far as the MCQ is concerned. Okay, so remember this Hunter and Sanfilippo. Moving to the third important metabolic keratopathy cause, that is Wilson disease. I know this is very important because questions has been repeatedly asked about the Wilson disease. You know about the Wilson disease, it's a copper deposition, means there is a deficiency of ceruloplasmin name enzyme. Okay, this ceruloplasmin is a copper carrying blood protein, right? And because of the deficiency of ceruloplasmin, there is a copper overload in the body, and this copper get deposited in the different parts of the body, damaging that organ, like in the renal and similarly in the eye also. Can you see this photo? Just see this photo. Here what you can see, this there is a deposition of something brownish color thing in the vertical meridian, like up and down. See, so what is this? This is the KF ring. Okay, this is the KF ring. KF ring means Kayser-Fleischer ring. Very important for the Neet PG. Okay, what is this? This is a copper deposits. The second question is very important, that where it deposit? It deposit in the Descemet's membrane, right? The third question is that there is a Fleischer ring also. You have seen the Fleischer ring in keratoconus, and this is Kayser-Fleischer ring in Wilson disease. So you have seen both, but the difference is that Kayser-Fleischer ring having the copper deposit, but the Fleischer ring in the keratoconus having the iron deposition. Second, Kayser-Fleischer ring is formed at the level of Descemet membrane, but the Fleischer ring formed at the level of epithelium only. How to see? This is sometimes being asked in the examination, that how to see this Kayser-Fleischer ring. How to see this Kayser-Fleischer ring? So to see this Kayser-Fleischer ring, you have to do slit lamp examination, and best is gonioscopy. So this can be a potential future question. I have not seen this type of question for the Neet PG examination, but this can be a potential future question, gonioscopy. Okay, now coming to this important point, that is this, and on anterior capsule of the lens you will have a sunflower type cataract. See, radiating spokes, sunflower like cataract. So this is a seen in the Wilson disease only. So in this way we have covered the Wilson disease, and this ends the metabolic keratopathy part 1. We will back with the metabolic keratopathy part 2 in the next step. Thank you very much.